What is a prostate? The prostate is a gland that is part of the male reproductive system. It is located just below the bladder and surrounds the urethra, which is the tube through which urine and semen pass out of the body. The prostate gland is roughly the size and shape of a walnut. The main function of the prostate is to produce and secrete a fluid that nourishes and protects sperm. This fluid, known as prostatic fluid, makes up a significant portion of semen, which is ejaculated during sexual activity. The prostate undergoes growth and development during puberty and continues to grow slowly throughout a man's life. What does a prostate do for a man? The prostate gland serves several important functions in a man's body. Here are the main roles and functions of the prostate. 1. Produces and secretes prostatic fluid. The prostate gland is responsible for producing and releasing a fluid known as prostatic fluid. This fluid makes up a significant portion of semen, which is ejaculated during sexual activity. Prostatic fluid nourishes and protects sperm, aiding in their motility and viability. 2. Helps with ejaculation. During sexual arousal, the muscles of the prostate contract to help propel the prostatic fluid into the urethra. This action, combined with contractions of other reproductive organs, helps propel semen out of the body during ejaculation. 3. Protects sperm. The prostatic fluid contains substances that protect sperm from the acidic environment of the vagina, enhancing their chances of reaching and fertilizing an egg. 4. Supports sperm transport. The prostate gland's location around the urethra allows it to provide muscular support to the urethra during ejaculation. This helps ensure the proper flow of semen out of their body. It's important to note that the prostate's functions are specific to male reproductive processes, and its presence is not essential for overall health and well-being. Structure of the prostate. The prostate gland has a unique structure that reflects its functions within the male reproductive system. Here is a description of the structure of the prostate. 1. Location and size. The prostate is situated just below the bladder, surrounding the urethra, which is the tube that carries urine and semen out of the body. It is located in front of the rectum, allowing it to be felt during a digital rectal exam, DRE. The size of the prostate can vary among individuals but is typically around the size of a walnut. 2. Lobes. The prostate gland consists of several lobes or regions. The anterior lobe, which is the smallest part, is located towards the front of the prostate. The posterior lobe is the largest and is situated towards the back. The isthmus connects the two lobes. 3. Capsule. The prostate is surrounded by a thin fibrous capsule that covers the gland and helps maintain its shape. 4. Zones. The prostate gland can be divided into several zones based on its anatomy. The peripheral zone is the outermost region of the prostate and is where the majority of prostate cancers develop. The central zone is located towards the middle of the gland and surrounds the ejaculatory ducts. The transition zone is situated near the urethra and is the region where benign prostatic hyperplasia, BPH, commonly occurs. 5. Ducts and glandular tissue. The prostate gland contains numerous small ducts that open into the urethra. These ducts carry the prostatic fluid produced by the gland. Surrounding the ducts are clusters of glandular tissue, responsible for secreting the prostatic fluid. 6. Stroma and muscle. The stroma refers to the supportive tissue framework of the prostate gland. It consists of fibrous connective tissue and smooth muscle. The smooth muscle fibers in the prostate help propel the prostatic fluid into the urethra during ejaculation. 7. Blood supply and nerves. The prostate receives its blood supply from branches of the internal iliac arteries. Nerves running through the prostate are responsible for controlling its functions and transmitting sensations. How big is the prostate? The size of the prostate gland can vary among individuals and can also change with age. On average, the size of a healthy adult prostate is approximately that of a walnut or chestnut. However, it's important to note that the size of the prostate can be influenced by factors such as genetics, hormonal changes, and the presence of certain conditions. As men age, the prostate gland tends to gradually increase in size. This natural growth is known as benign prostatic hyperplasia, BPH, and is considered a normal part of the aging process. In some cases, the enlargement of the prostate can lead to urinary symptoms and require medical attention. To assess the size of the prostate, healthcare professionals may perform a digital rectal exam (DRE), during which they can estimate the size and feel any abnormalities. Additionally, imaging techniques like ultrasound or MRI may be used to obtain more precise measurements of the prostate volume. How much does your prostate weigh? The weight of the prostate gland can vary depending on factors such as age, overall health, and individual variations. On average, the weight of a healthy adult prostate is approximately 20 to 30 grams, 0.7 to 1.1 ounces. However, it's important to note that the prostate can undergo changes in size and weight due to various factors, including prostate enlargement, BPH, inflammation, prostatitis, and the presence of prostate cancer. In some cases, the prostate can become significantly larger and weigh more. Do women have a prostate? Traditionally, it was believed that women do not have a prostate gland. However, recent scientific research has challenged this notion and suggests that women do possess a glandular structure known as the female prostate or Skene's glands. Skene's glands. Skene's glands, also referred to as periurethral glands, are located around the urethra in females. These glands are believed to be homologous to the male prostate gland and share some similarities in terms of their embryological origin, histological structure, and the secretion they produce. The exact function of the female prostate is not fully understood, but it is believed to play a role in female sexual function and lubrication. Similar to the male prostate, Skene's glands can also be a site of various conditions and disorders, such as inflammation or cysts. It's important to note that the presence and significance of the female prostate are still subjects of ongoing research and discussion in the scientific and medical communities. Further studies are needed to gain a comprehensive understanding of the female prostate and its role in women's health. What are the common conditions and disorders that affect the prostate? Several common conditions and disorders can affect the prostate gland. Here are some of the most notable ones. Benign prostatic hyperplasia, BPH. BPH is a non-cancerous condition characterized by the enlargement of the prostate gland. It can cause urinary symptoms such as frequent urination, weak urine flow, difficulty starting or stopping urination, and the feeling of incomplete bladder emptying. Prostatitis. Prostatitis refers to inflammation or infection of the prostate gland. It can cause symptoms such as pain or discomfort in the pelvic area, painful urination, frequent urination, urinary urgency, and sometimes fever. Prostatitis can be classified into acute bacterial, chronic pelvic pain syndrome, and asymptomatic inflammatory prostatitis. Prostate cancer. Prostate cancer is the most common cancer in men. It typically develops in the cells of the prostate gland. Symptoms may not be present in the early stages, but as the cancer progresses, it can cause urinary difficulties, blood in the urine or semen, erectile dysfunction, pain in the pelvic area, and bone pain. Prostate infections. In addition to prostatitis, the prostate can be affected by other types of infections, such as bacterial infections or sexually transmitted infections, STIs. These infections can lead to symptoms similar to prostatitis, including pain, urinary problems, and discomfort in the genital area. Prostate calcifications, or calcified deposits, can sometimes develop within the prostate gland. These are usually benign and often discovered incidentally during medical imaging exams. They typically do not cause symptoms or require treatment. Prostate abscess. In rare cases, an abscess, a collection of pus, can form within the prostate gland due to infection. This condition may cause severe pain, fever, chills, urinary difficulties, and require prompt medical attention. Symptoms. What are the warning signs of prostate problems? Prostate problems can present a variety of symptoms. While the presence of these symptoms doesn't necessarily indicate a specific condition, they can be warning signs that prompt further evaluation by a healthcare professional. Here are some common warning signs of prostate problems. 1. Urinary symptoms. Frequent urination, especially during the night, nocturia. Urgency to urinate. Weak urine flow or difficulty initiating urination. Dribbling or leakage after urination. Feeling of incomplete bladder emptying. Straining while urinating. 2. Changes in urination. Blood in the urine. Hematuria. Blood in the semen. Painful or burning sensation during urination. Difficulty stopping or controlling the urine stream. 3. Sexual function. Erectile dysfunction, difficulty achieving or maintaining an erection. Pain or discomfort during ejaculation. 4. Pelvic pain or discomfort. Pain or discomfort in the pelvic area, lower abdomen, or lower back. Pain in the genitals or perineum, area between the scrotum and anus. 5. Other symptoms. Unexplained weight loss. Fatigue or weakness. Bone pain, if prostate cancer has spread to the bones. It's important to remember that these symptoms can be associated with various conditions, not just prostate problems. Additionally, some prostate conditions, such as early-stage prostate cancer or prostatitis, may not cause noticeable symptoms. Regular checkups and screenings, particularly for men over the age of 50, or those at higher risk, can help detect potential prostate problems even before symptoms arise. What are common tests that check the health of the prostate? To check the health of the prostate, healthcare professionals may use various tests and examinations. Here are some common tests and screening methods used to assess prostate health. 1. Digital rectal exam, DRE. In a DRE, a healthcare provider inserts a gloved, lubricated finger into the rectum to feel the size, shape, and texture of the prostate gland. This examination allows them to check for any abnormalities, such as lumps or enlargements. 2. Prostate-specific antigen, PSA, blood test. The PSA blood test measures the level of prostate-specific antigen, a protein produced by the prostate gland, in the blood. Elevated PSA levels can indicate prostate conditions such as BPH or prostate cancer. However, it's important to note that PSA levels can also be elevated due to non-cancerous factors. The decision to undergo a PSA test and the interpretation of the results should be discussed with a healthcare professional. 3. Transrectal ultrasound, TRUS. A transrectal ultrasound involves the insertion of a small ultrasound probe into the rectum to obtain images of the prostate. This imaging technique can help evaluate the size, structure, and abnormalities within the prostate gland. It is commonly used alongside other tests, such as biopsies, to guide the sampling of prostate tissues. 4. Prostate biopsy. A prostate biopsy involves the collection of small tissue samples from the prostate gland for laboratory analysis. This procedure is typically performed under local anesthesia using a needle guided by imaging techniques like ultrasound or MRI. Biopsies are commonly done when there are suspicions of prostate cancer based on other test results, such as elevated PSA levels or abnormal DRE findings. 5. Imaging tests. Imaging tests like ultrasound, MRI, magnetic resonance imaging, or CT, computed tomography, scans, may be used to visualize the prostate gland and surrounding tissues more clearly. These tests can help evaluate the size, shape, and possible abnormalities within the prostate, and are often used in cases where there are concerns about prostate cancer or other conditions. The specific tests used to assess prostate health may vary depending on individual circumstances, symptoms, and risk factors. It's essential to consult with a healthcare professional who can determine the most appropriate tests based on your specific situation and guide you through the process. Regular checkups and screenings are particularly important for men at higher risk or those with a family history of prostate conditions. What are common treatments for the prostate? The choice of treatment for prostate conditions depends on a specific condition and its severity, as well as individual factors such as age, overall health, and patient preferences. Here are some common treatments for prostate-related conditions. 1. Benign prostatic hyperplasia, BPH. Watchful waiting, if the symptoms of BPH are mild or not bothersome. A healthcare professional may recommend regular monitoring without immediate treatment. Medications. Certain medications can help manage BPH symptoms by relaxing the muscles of the prostate and improving urine flow. These may include alpha blockers, 5-alpha reductase inhibitors, or combination medications. Minimally invasive procedures. Procedures like transurethral microwave thermotherapy, TUMT, transurethral needle ablation, TUNA, or laser therapy can be used to shrink or remove excess prostate tissue, relieving urinary symptoms. Surgical interventions. In cases where symptoms are severe or other treatments are ineffective, surgical options such as transurethral resection of the prostate, TURP, or laser prostatectomy may be recommended to remove or reduce prostate tissue. 2. Prostatitis. Antibiotics. If prostatitis is caused by a bacterial infection, antibiotics are prescribed to treat the infection. Pain medications. Over-the-counter or prescription pain relievers may be used to manage pain and discomfort associated with prostatitis. Alpha blockers or muscle relaxants. These medications can help relax the muscles around the prostate and improve symptoms in some cases. Lifestyle changes. Certain lifestyle modifications, such as stress reduction, regular exercise, and avoiding irritants like caffeine and spicy foods, may help manage prostatitis symptoms. 3. Prostate cancer. Active surveillance. For low-risk prostate cancer, where the cancer is slow-growing and unlikely to cause harm. Active surveillance involves regular monitoring of the cancer's progression with PSA tests, DREs, and occasional biopsies, without immediate treatment. Surgery. Radical prostatectomy involves surgical removal of the prostate gland. It may be recommended for localized prostate cancer. Radiation therapy. High-energy radiation is used to target and destroy cancer cells. It can be delivered externally, external beam radiation therapy, or internally, brachytherapy. Hormone therapy. In advanced prostate cancer, hormone therapy may be used to block the production or action of male hormones, androgens, that stimulate cancer growth. Chemotherapy. Chemotherapy drugs can be used to kill cancer cells or control the spread of advanced prostate cancer. Immunotherapy and targeted therapy. These newer treatment approaches aim to stimulate the body's immune system or target specific molecular markers on cancer cells to treat advanced prostate cancer. The choice of treatment and the specific approach will be determined by a healthcare professional, based on factors like the stage of the condition, the aggressiveness of the disease, and the individual patient's health profile. How do I keep my prostate healthy? While there is no guaranteed way to prevent prostate problems, adopting a healthy lifestyle and making certain choices may help promote prostate health. Here are some tips that may contribute to maintaining a healthy prostate. 1. Eat a balanced diet. Include a variety of fruits, vegetables, whole grains, and lean proteins in your diet. Some studies suggest that a diet rich in fruits and vegetables, particularly those with lycopene, example, tomatoes, may have a positive impact on prostate health. 2. Maintain a healthy weight. Obesity and excess body fat have been linked to an increased risk of prostate problems. Aim for a healthy weight through a balanced diet and regular exercise. 3. Stay active. Engage in regular physical activity, such as walking, jogging, swimming, or other forms of exercise. Regular exercise can contribute to overall health and well-being, including prostate health. 4. Don't smoke. Smoking has been associated with an increased risk of developing aggressive forms of prostate cancer. If you smoke, consider quitting or seeking professional help to quit smoking. 5. Limit alcohol consumption. Excessive alcohol consumption has been linked to an increased risk of prostate problems. If you choose to drink alcohol, do so in moderation. 6. Stay hydrated. Drink an adequate amount of water daily to maintain proper hydration. Sufficient hydration can support urinary health. 7. Regular checkups. Visit your healthcare provider regularly for routine checkups and screenings. This can help detect any potential prostate problems early on, even before symptoms manifest. 8. Know your family history. If there is a family history of prostate conditions, inform your healthcare provider. Some prostate problems can have a hereditary component, and this knowledge may influence screening recommendations and overall prostate health management. 9. Be informed. Stay informed about prostate health, common conditions, and symptoms. Awareness can help you recognize any warning signs and seek timely medical advice if needed. It's important to note that while these tips may contribute to overall prostate health, they do not guarantee prevention or protection against prostate problems. Can supplements improve my prostate health? The use of supplements for prostate health is a topic of ongoing research and discussion. While some supplements have been studied for their potential benefits, it's important to approach them with caution and consult with a healthcare professional before starting any new supplement regimen. Here are a few supplements that have been commonly associated with prostate health. 1. Saw palmetto. Saw palmetto is a herbal supplement that is often used for symptoms of benign prostatic hyperplasia, BPH. Some studies suggest that it may help reduce urinary symptoms associated with BPH, such as frequent urination and weak urine flow. However, the evidence is mixed, and further research is needed to establish its effectiveness. 2. Beta-sitosterol. Beta-sitosterol is a plant sterol found in various foods and is also available as a supplement. It has been studied for its potential benefits in improving urinary symptoms related to BPH. While some studies have shown modest improvements, others have not found significant effects. More research is required to draw definitive conclusions. 3. Pygeum. Pygeum is an herbal extract derived from the African plum tree. It has been used traditionally to alleviate symptoms of BPH. Some studies have suggested that pygeum may have anti-inflammatory effects and improve urinary symptoms. However, the evidence is limited, and additional research is needed. 4. Lycopene. Lycopene is a natural pigment found in tomatoes and other fruits. It is known for its antioxidant properties. Some studies have suggested that lycopene may have a protective effect against prostate cancer. However, more research is necessary to establish a definitive link. It's important to note that supplements are not regulated in the same way as prescription medications, and their safety and effectiveness may vary. Moreover, certain supplements may interact with medications or have potential side effects. Therefore, it is crucial to consult with a healthcare professional before starting any supplements to ensure they are appropriate for your individual circumstances. Can you live without a prostate? Yes, it is possible to live without a prostate. The prostate gland is not essential for basic survival, and its removal may be necessary in certain situations. The most common reason for the removal of the prostate gland is the treatment of prostate cancer. In a procedure called a radical prostatectomy, the entire prostate gland, along with surrounding tissues, may be surgically removed to treat localized prostate cancer. After the removal of the prostate, the urethra is reconnected to the bladder to restore the flow of urine. Living without a prostate can have some implications, including the following. 1. Infertility. The prostate gland plays a role in the production of seminal fluid, which helps nourish and transport sperm. After a prostatectomy, a man may no longer produce semen during ejaculation. This means that fertility may be affected, and natural conception may not be possible. It is important to discuss fertility preservation options with a healthcare professional before undergoing prostate removal surgery if preserving fertility is a concern. 2. Urinary changes. The removal of the prostate gland can sometimes lead to urinary changes. This may include temporary or permanent urinary incontinence, involuntary leakage of urine, or changes in urinary function, such as a weaker urine stream or a need to urinate more frequently. 3. Sexual function. The prostate gland is also involved in sexual function, particularly in terms of ejaculation. After prostate removal, some men may experience changes in sexual function, such as erectile dysfunction or changes in orgasm sensation. However, the impact on sexual function can vary between individuals, and there are various treatment options available to address these concerns. It's important to note that the specific effects of living without a prostate can vary from person to person. Individuals who have undergone a prostatectomy should work closely with their healthcare providers to manage any potential side effects and adjust to any changes in urinary, sexual, or reproductive function. Rehabilitation programs, such as pelvic floor exercises and counseling, can be helpful in managing the potential challenges associated with living without a prostate.